Cancer, the most dangerous name. The moment you hear this illness called cancer, there are so many questions that come to your mind, and there's so much anxiety that runs through your brain. Today, to set it all right, we have Dr. Amit Gandhi with us, who are going to answer our queries, our questions on cancer. Cancer is a very vast topic, so we thought an episode won't be enough to cover it all. So today, we are specifically going to talk about cancer in women. Dr. Amit Gandhi is a cancer surgeon at CritiCare Asia groups of hospitals, Mumbai. Welcome, Dr. Amit Gandhi.
Thank you, ma'am. Thank you.
As discussed, we are going to be discussing cancer, and especially cancers related to females. So could you just throw some light on what are the various types of common cancers that you see in women?
So basically, let's put it this way: which are the most common cancers in women? What you're asking. So the first cancer which women should get worried about is breast cancer. Okay, the worry should lie at that it is a cancer. Okay, it is a completely curable cancer. Mm-hmm. If God comes down on the planet and says that okay, there's a possibility that you can get a cancer, the first thing a woman should say, give me a breast cancer or thyroid cancer. Okay, so no one likes cancer, that's for sure. But both these cancers which I am talking about, breast and thyroid, are completely curable. Wherein if you get the diagnosis, you should be as much worried as when you have diabetes, when you have blood pressure, or when you have any fracture or something like that. It's a treatment which encompasses approximate 6 months, but the total duration in the hospital is only 1 or 2 nights.
Okay.
Only 1 or 2 nights. Rest of the times, you're going to come once in 21 days, probably 6 to 8 hours, surgery 1 night. So it's a very simple treatment. Most importantly, it's completely curable up to the stage of 3. 1, 2 and 3.
I was about to ask you, when you say it's completely curable, is when it's diagnosed earlier or?
So, it is if diagnosed early, as as the saying is in Tata, cancer is curable if detected early. So any cancer detected early is curable. Mm-hmm. In breast cancer, mm-hmm. even if you detect by stage 3, mm-hmm. it is curable.
Okay. Doc, when you're talking about the stages of cancer, I know most of us know it, but still most of us still want some clarity on it. What do you mean by first, second, third and fourth stage of cancer?
Very important question, because if this happens to be an awareness topic, the women who are watching this, they are supposed to be the best form of communication in the world. Women, okay, you may have a telephone, you may have a internet, so you may have anything, but the best communication skills who has? Women. Okay, and there's no question about it. So the staging is how, if for stage 1, very simple for any women to remember, if it starts in the breast and the lump is only in the breast, it is stage 1.
Okay.
Stage 2 means that's 2 places. One is in the breast and second is in the axilla, जो हिंदी में खाक बोलते हैं, okay, बगल बोलते हैं, तो यहाँ पे, okay, exactly. So those are the lymph nodes. So that is stage 2. Stage 3 is when it is too big over here and when it is too big over here. Okay, so very simple differentiation. Stage 4 is what we don't want to see, and that is why the whole world is talking about breast cancer awareness. That you don't come to us late. So when you say late means what? Stage 4. Stage 4 when it leaves these 2 parts and goes to other organs. So liver, lungs, bones, brain. If you ask me in my practice, 2008 I started and now it's 2023. If 2008 to 2012, I would see maybe in a month say 5-6 stage 4 patients. Now I am hardly seeing one patient because of the awareness. Patients are coming very early to us and we are sort of looked up as you are the one who cured, but actually you have cured yourself by being educated. That when to reach the doctor at the earliest. The first cure is when you enter into a doctor's cabin and knowing that there's a lump which is only 1 month old. Okay. You keep it like, don't try to be Mother India. Mother India days are over. You look at yourself. If you look at yourself.
My next question was, when you say that you've cured it yourself, it's a very nice information that you've shared with us, that people are coming earlier and you are able to save so many women as it is because they are so aware. But still, India is so vast and the population is uneducated and there's so many people that we still need to reach out. Doctor, can you throw some light what a woman needs to do? How should they take care of themselves, or how should they be a little more vigilant about themselves so that they can detect this earlier or feel some discomfort earlier? so that they can come to you?
So the other way of putting this is actually asking me what are the causes.
Causes and the symptoms.
Yeah. So the basically how it begins is that you will start with a very small lump in the breast. So for knowing that you should.
And there's no cause for this lump.
There's no cause. So for every cancer there is only one cause, idiopathic. Okay. Idiopathic means what? You divide that as idio and pathic. Idio means idiot. Pathic means pathology. No one has understood this pathology. Okay, it's idiopathic. Then rest of the things come: smoking, alcohol, tobacco, and all other things. When you encompass all these things, then only you will get this disease. Okay. So when you say that what are the symptoms, you will come with a lump in the breast. So your first thing is, okay, lump आया तो पता कैसे चलेगा? Simple. You have to learn self breast examination. So everyone talks, scientifically, mammography करो, sonography करो, सब बंदे नहीं जा सकते. If you tell a woman tomorrow in your own house, who's about 45, chalo mama will go for sonography, mammography. Mama will tell you, I don't have any problem, why should I come?
Correct.
So what you do is you teach your mom, your sister, whoever.
So what you suggest is don't ignore yourself.
And learn.
Even if you're very fit,
yes,
you still need to be cautious about your health.
Yes. So if you ask me, the first thing in schools they should teach is self breast examination. And it is not necessary that you teach only girls or women. It should be known to everyone. Okay. So of course male breast cancers are very rare. It's like almost 1% only as compared to female. But you should know self breast examination. And there are 100 videos on the net. You just type on Google self breast examination. Every oncologist has made a video on this. So you can just go and check it out. Okay. So,
and we are also sharing a chart here.
Yeah.
Or sharing a link.
Yeah. So basically I understand that, so if you want to tell me very simply for you to understand, doctor's sign, doctor's sign is plus. Okay. So once you divide the breast into plus sign. Okay. The clock is 12, 3, 6, 9. So you divided the breast into 4 parts. Each part is called as a quadrant. So every quadrant you palpate. So from first quadrant, second quadrant, third quadrant, fourth quadrant. This is self breast examination.
Okay.
Very simple. And you have to palpate with the flat of the fingers, not with the tips. Many women try to palpate like this. Okay, the flat of the fingers are more sensitive as compared to tips. It is a completely paradoxical thing which the normal person thinks that no, it is the tips. No, you have to do it with the flat of your hand.
Okay.
And moment you find a lump, okay, no matter what your age is,
painful or not painful, anything.
Yeah, anything, whether it's painful, painless, okay. No matter what the lump is, if you detect a lump, please meet a good doctor. So the good doctor can be who? Good doctor may be a BMS, maybe a BHMS, maybe an MBBS. But when I say good means what? He knows what he's talking about. So he should not just tell you.
It can be your personal gynae.
Yes.
It can be a general practitioner.
Yes.
Also,
anyone.
Whoever the doctor that you're comfortable with. Don't self-treat yourself.
Moment you go to them and if they tell you that it is nothing, so you can just ignore it and all that. That means you have to take a second opinion. Okay. 2 people tell that it's nothing to worry about. Then you can think of, but the second person should be super intellectual guy. So he should be a surgeon, he should be a cancer surgeon, these two only. Okay.
And there are some tests besides?
Yeah, so once you come to know that you have a lump, the first thing you can do is if you are below 35, you go for sonography of the breast.
Okay.
If you are above 40, 45, even till 40, it's okay if you do sonography. Above 40, you should do mammography. Okay. The reason being, younger the female, more the fat content, and fat content differentiation with the lump is better on a sonography as compared to on a mammography.
Okay.
When you cross 40, 45, the breast loses its fat content, which is natural as a part of process of aging. So that time the mammography comes into place. Okay. And if you're too worried about mammography, because mammography machine is, it's like, everyone Googles, so like, usme raise hota hai, ye hota hai, wo hota hai. You do not get worried. You can do sonography at any age. That's not a problem. But do some investigation wherein the investigation will tell very clearly it is disease or no disease. If there is a doubt whether it is disease or no disease, then comes the next test. So the next test is a needle test, which is called as fine needle aspiration cytology, FNAC.
Okay, doctor, before we go ahead, I wanted to know this, the test that you said for breast cancer or any breast cancer or ovarian cancer or any cancer in women, what is the age group Obviously, younger girls may not be so prone to it. The
Correct.
older age is more prone to it. So how?
So if you look at breast cancer,
Mm-hmm.
women above the age of 40 or maybe post-menopausal women.
Mm-hmm.
Okay, so a national average, the Indian the average in an Indian women, the average age of menopause in the Indian population stands at 52 years.
Okay.
Okay, so post-menopausal means you should not take it as 52. You should take it as 48 to 52.
Okay.
Because that also is like perimenopausal.
Correct.
So when you get a lump in the post-menopausal women, no ways it should be ignored. The first diagnosis and only diagnosis remains cancer. Okay, rest all comes into 1%.
Oh.
Post-menopausal.
Okay.
When it is premenopausal, then you can think, okay, I may not have cancer, I may have something else. So 30, 35, 40 years old, if you have a lump, you should first thing not get too much worried that you have cancer. Doesn't mean that you ignore what I have already told, that you should do a sonography, you should do a self-breast examination. If these two things says it is no cancer, be relaxed. Okay, if these two says there's a doubt, do your sonomammo and your FNSC. So the age group which is most prone is postmenopausal.
Postmenopausal.
The premenopausal very
and
less.
God forbid if it's like we hear some cases where the breast cancer is detected in a 16 years old, 18 years old.
So as you are asking me, I'm telling you, I operated 1 month back a 16-year-old girl for breast cancer. Okay, so it is not that it's not there in young women. It is there.
It is rare.
Okay, but it is very, very rare.
Okay.
The fact of the matter is that
like one in
the younger ones.
1 in 1,000, 1 in 500.
I tell you my personal experience. This is the youngest patient I've ever operated, including my days in Tata. Okay. So I have not seen a 16-year-old in my life.
Career span?
It's almost like if you count my training period as well, so it's now almost 22 years.
So in 22 years, this is the first 16 years old
Yes,
that you have
yes.
operated for breast cancer.
Yeah.
So it is that rare, but still there.
Yeah. Otherwise, I'm operating probably you can say 10 to 15 breast cancers a month.
Okay.
So in those many cases, I could get only one young female.
Okay.
Which when I met her and she sat with me, the only thing I could think was that how can this girl get it? And the entire hospital was emotional about it. Yes. Okay, because we have not seen such young girl, right? Correct. But the spirit which she had, that is the spirit which every cancer patient should have. And doctor, I'm going to get all right. I have my exams coming up. Just make me all right before the exams. Okay.
Okay. So also, though it's very rare, but we have to be careful about the young girls as well. And the age group which is more prone to breast cancers are the ones closing to menopause, which is pre-menopause, during menopause, or after that.
Correct.
Okay. And after you've done the test, what is the next procedure that
so
one needs to
moment
follow?
you do, suppose your
if it's confirmed.
Yeah. Suppose so when you combine sonography, clinical breast examination, and an FNSC, the accuracy of these three combined is 95% to detect cancer. Okay. So now the question comes that cancer is detected. Suppose. So the next step is you go and meet your oncologist. It may be a surgical oncologist, ideally, not because I am a surgical oncologist, but as captain of the ship, we really drive the ship very well. Okay. Or you can even go to a medical oncologist. Okay. Or you can even go to a radiation oncologist, depending on whoever is close to you, because the pre-op workup has to be done. Ideally, you should go and meet your cancer surgeon. He will examine you, evaluate you, tell you your staging and all, and he may advise you some test, okay, to see whether this cancer is spread to other organs of the body. Okay, so if you come to me, generally I advise sonography, X-ray chest, bone scan. Okay, in some patients I straight away advise a PET scan. Okay, because most of the people, if you tell them they have to go to 3 places, they say, sir, मुझे नहीं हो रहा है, कहीं एक साथ में कुछ होता है, तो I advise a PET scan, but ideally.
So what is the difference between the other scan and the PET scan?
Yeah, so sonography will tell you about the liver, X-ray will tell you about the lungs, and bone scan will tell you about the bones.
Yeah, whereas PET will cover it all.
Cover it all in one go, and even if we try to tell them that it's okay, you can do these 3 tests, most of the patients end up doing a PET scan and coming back because of the everyone knows there's something called a PET scan. Okay, so one test covers everything, so they do it.
Okay, so once the cancer is detected, how crucial is the timelines?
So this thing now that you go and meet an oncologist and he tells you that you have cancer and you should operate, he tells you that you should operate. So most of the patients think now you should operate next day. Okay, so you should not be under the influence that it has to be done very quickly.
Okay.
When I say it should be done quickly, but not very quickly, why I say it should be quickly is after you meet your oncologist, give yourself 48 to 72 hours to talk with your best friends, your family, confide in them, get confidence, and after 3 days you go and meet them and then take the dates for surgery or whatever it is. Don't be like you see today and now tomorrow only you have to operate or day after. There's no such thing. 7 days waiting, no problem.
Yeah, generally the notion is, oh God, it's cancer, it may be spreading, and you just need to get it done right there, right now.
So most of the people have this thing ki, we got to know, so can you operate tomorrow?
But at the same time, the timelines are crucial.
Timelines are crucial. That's why I said not very quickly, but quickly. So
but
when
not too late too.
Yeah, moment you do any investigation like PET scan, FNAC, within 15 days of that you should be on OT table to operate, or in a hospital for chemotherapy. One of the two should be started for breast cancer within 15 days of a diagnosis.
Yeah. So one more thing, as a common person, which people keep asking me is sometimes they suggest chemotherapy first and then the surgery. Sometimes they suggest surgery first, then the chemotherapy. So why do we do this combination?
So we divide this population of breast cancer patients into those who want the breast to be saved, and those who don't want to save the breast.
Okay.
Everyone has their own thought process that they want to save the breast or they don't want to. It's up to the patient per se and their husband. So once they say, if they come in stage 1 and stage 2, okay, we generally advise the surgery straight away, okay, and then give the chemotherapy. But if they are in stage 3, when the lump is too big and the lymph nodes are too big, we generally advise whether you're saving the breast or not saving the breast. Either ways, we advise do chemo first and then surgery. Why is the difference in stage 1, stage 2 and stage 3? So when it is stage 3, you know that it is gone here and number of lymph nodes over here more than one, right? So the possibility of this going to other parts of the body via the circulating cancer cells are very high.
So what do you mean by circulating cancer?
So these are tumor cells in the bloodstream which are not gone deposited in any organ, but has the possibility of depositing and developing metastasis in the near future anywhere in the body. So if you operate, suppose stage 3, which are operable, okay, what will happen? Till the wound doesn't heal, you cannot do chemo. So you are giving the tumor cells, the circulating tumor cells, almost like 14 to 21 days for them to do their work. Circulate. Rather
build their empire.
Rather you do the first chemo you start on 1 day. Within 3-4 days you are very relaxed that the rest of the body is sterilized.
Okay. That's so important. That's such an important information, because that's what commonly people think. And sometimes they're so anxious, but they have so many questions that they miss out asking to their doctors. Here, Dr. Amit Gandhi is answering that query of yours, that you're at least trying to save rest of the part of your body while you treat the main cancer.
Correct. The problem is when we tell someone now that we need to do the chemo first. Okay, so right now it's like every individual is a doctor. Okay, there is a lot of social media thing. So we don't know how the chemo is going to work. In spite of we explaining, they still want to find someone who can straight away knock off the surgery.
I'm sure there's a lot of evaluation that you'll do, and then come up with these treatments, whether chemo first or surgery first. So please leave that to your expert, because if we all knew medicines and science, we didn't need doctors around. So I think you should trust your doctor, and
absolutely,
there is a science, there is an evaluation that they put in place before they suggest anything to you.
So trust is the most important thing. It's a difficult situation everywhere, okay, of trusting anyone and everyone. But trust.
Also, sometimes, doctor, it's trust. Sometimes it's also the anxieties that if I do the chemo, the side effects of chemo. So if you could just throw some lights on the side effects of chemo and how we can overcome them.
So the side effects of chemo, the main side effect with the lady worries about is hair loss. Okay, I'm going to lose all my hair, and of course, the beauty of a woman is related with the hair most, usually. So we losing hair, and then I'm becoming bald, and then I meet people and they come to know. So basically, if you're not happy with yourself, okay, no one will be happy with you.
So it's more of an emotional thing than the physical
and physical thing. Yes, a lot of women are worried that I get hair loss, but moment you accept it, I want to live and I'm okay with this because the hair
No,
comes
it's
back.
an emotional thing with the physical change.
Yes.
But otherwise, chemo is a best friend of any cancer patient, right?
Fantastic. I'm telling you, like the 16-year-old girl which I spoke about, I'm 100% sure that she's going to reach 60, 70. This breast cancer is not going to claim her.
Wow,
I'm
that's such a
100%
positive.
sure.
That's such a positive.
Okay, and that girl is ready for all treatments.
Yeah.
Everything.
So that's the spirit. Yeah,
Yeah.
that's the spirit.
And as luck would have it, when we operated her and we finished, she does not require radiation. She only required surgery plus chemo, and she's still going to not. This disease is not going to claim her because she came early.
Okay. So now, while talking, as you mentioned, there's chemo, there's radiation. So now the times have changed. Earlier, it was only the chemos, and the chemos side effects were also very, very severe too. It has mild,
Yes,
it has little milder effect now.
Yeah, so it's just like you had your landline and now you have a mobile. So the same way, that time we had drugs which were giving a lot of side effects. As it evolved, we got beautiful drugs now, which most of the patients can handle very easily. So apart from hair loss,
the side effects are also much lesser.
Hardly for breast cancer chemotherapy the patients who are taking, the side effects, I'm not saying they are not there, but easily manageable for the patient.
Manageable.
The only side effect.
Also, doctor, do you all pack them up with some other things also to manage the side effect?
So there's something called as pre-medication. So whenever we give chemo prior to that, we give you a drug which is going to prevent vomiting, acidity. After the chemo also we give you drugs for 5 days. So all those things are taken care of.
Okay.
Yeah.
So to a large extent, you all are able to control the side effects of the chemotherapy as well.
So
except for the hair loss or few things. Is it that everybody has hair loss with chemo, or some people may not have, or some people may have less?
The percentage is very less, but anyone taking a breast cancer chemotherapy is going to end up with losing hair.
Okay.
So there is
the hair comes back. That's what our viewers need to know.
There is a new technology which, if you want, you can go and do it, and that is called as the cool cap technology.
Okay.
So basically, young women who are unmarried, and of course for them hair is very important, right? So for them, there's this technology where during the chemo, a cap which is it's called as a cool cap. Okay, you need to wear that during the chemotherapy, and that prevents the hair loss. So there is a way
It's actually a very cool cap.
Yeah. It's a cool cap. Yeah.
It's a very cool cap, and it can keep you looking cool.
So
and
the
nice.
funda in that is what we know.
Even though you're going through a rough patch.
The funda in that is because of the temperature, the vessels gets narrowed, and the chemo doesn't reach the scalp, and then you don't get the hair loss. As simple as that.
Wow.
Okay. So sir, ठंडा भी रखता है थोड़ा.
So is this the latest thing?
This is not the latest. It came up in like, I think, I'm not too sure, but in it's almost like 7-8 years.
But then you've seen women or men.
Yes.
And it comes with what? How much additional cost, for example?
So it varies from center to center, but usually they add on a cost of say 5 to 7K per chemo extra.
Okay.
It depends on center to center.
Yeah.
Okay.
But if you're comfortable, it's worth the price.
So I would say 3% to 10% of my patients go for full cap.
Okay.
90% don't go for it.
Okay. And like as you were saying, there was chemotherapy, now there's radiation.
Yeah.
So will you just take us through the variety of things available?
Yeah. So for stage 1, stage 2, usually surgery plus chemo. Okay. Sometimes radiation. Stage 3, all.
No, so the difference I wanted to know from what is the like sono
Why?
is different from PET CT. So like that, what is different between chemotherapy, radiation, and other things?
So I'll tell you what surgery does. Surgery will do local control. Breast nikalna.
Sorry, we can come point by point. First point is the question is that
difference between the three.
The difference. What are the things available? I don't know if there are 3, there are 5. I don't know about it. So what are the things available?
Okay.
What are the options available, and then the differences?
So the options available for breast cancer treatment are surgery, chemotherapy, radiotherapy. These 3 are the main arms. Surgery is for removal of the organ along with the lymph nodes. After removal, if the tumor size, the cancer tumor size is more than 1 centimeter, or one of the lymph nodes is positive, you require chemotherapy. Okay. And if more than the tumor size is the tumor is involving the skin plus lymph nodes are positive, you require the radiation as well.
Okay.
So the easier way to understand this is
to assess this.
No lymph node in the axilla, no radiation.
Okay.
Tumor size more than 1 centimeter, chemotherapy required. Okay, this is in a very broad ways.
And there are combinations of chemo and radio.
Yeah.
Both
Now, what all these three things do to the body are completely different. So, surgery, removal of the organs. Chemo, it is given through the vein. From the vein, the drug goes into your heart. The heart pumps.
Okay.
So, when it pumps now, it doesn't pump that abhi main sirf brain, breast ke paas bhejunga.
मतलब from the vein, it gets mixed in your blood, goes to your heart, and the heart pumps into the
into the system.
To the body.
So when it pumps, it doesn't pump only in the breast, it will pump in the rest of the parts of the body.
Correct.
That is why you get side effects. Okay, because it is not only going to the breast but other parts of the body also.
Correct.
And because it is going to the other parts of the body, it covers and sterilizes the whole body and prevents development of cancer in other parts of the body. So that is the work which chemo does.
Yeah, that's
then
the
why
science that works.
then why radiation? अभी दोनों तो हो गया ना, local control हो गया, distant control हो गया, ये बीच में radiotherapy का क्या नया है? So why radiotherapy is given? A knife when you are operating can reach only a certain areas we can't reach.
Like now you're talking about the depth of the cancer.
Not depth of the cancer but extent.
Extent.
Okay, so suppose if it's breast, okay, so I remove here and and the nodes here, okay. So when they do the radiation, they cover this much area.
Okay.
So where there is no disease also they cover. Okay, we don't remove where there is no disease. Okay.
The periphery.
Okay. So it hits. So then it becomes a total control. Okay.
Also in some situations, for example, if it's going behind the heart or close around those organs, where you can't, you don't want to do the insertions.
It's called as
so that's where the radiotherapy
works, and it's like you covered all your fields. There's nothing left.
It's just ensuring more and more coverage for better treatment and better recovery.
So these three, broadly these three are enough. So now each one of them has their own thing, which for a layman is not important. Okay. Like you'll keep reading this on the net now always, targeted therapy and immunotherapy and all that. That can be a separate topic altogether. But these three things are important.
These three are important for, as of now, for breast cancers.
And if you ask me
most commonly used.
Yeah, if you ask me stage wise, stage 1 will require basically surgery, 2 will require surgery plus chemotherapy plus radiotherapy, 3 will require all 3, 4 will require only chemotherapy usually.
Okay. So usually chemotherapy, but does it get controlled by?
So now there are good human beings.
Or we're just making it easier for
So there are good human beings and bad human beings. When you meet me for the first time, you'll find he's a very good guy. Okay, but you have to spend time with me. When you spend time 1 month, 1 year, 6 months, you meet the person again and you come to know his pros and cons. When you put under stress, क्या होता है इसको? When you don't put him under stress, what happens? So then you decide, ये good है या bad है. Same thing is with cancer. So there is no cancer as good cancer. But I divide myself as breast cancer, as you have a good breast cancer, you have a bad breast cancer. So good breast cancer is what? A breast cancer.
They respond well.
They respond well to treatment. Now how do you know beforehand they'll respond? Why am I saying to that girl, the 16-year-old girl, that you are not going to die because of this or you want to reach 75? Because there are 3 receptors which a breast cancer tumor has. Estrogen receptor, progesterone receptor and HER2 receptor. Okay. So when these 3 receptors are present on the breast tumor cancer cells, they respond beautifully to chemotherapy, they respond beautifully to treatment. There is a targeted therapy which works beautifully, and that's why we say if you are triple positive, this is called as triple positive. Don't bother, you'll live. So even if it is stage 4, we still give them 3-4 years. I'm telling you, patients live of stage 4 breast cancer, triple positive. But opposite, triple negative, they are very poor responders to chemo.
Like what you're trying to say is, even if you give the same treatment to 2 different people, it may work wonderfully well in one and may not work as well. So as they always say, that medicine is not the perfect science.
Yes.
It's the best science.
So we are still trying. What you said in the perfect science thing, we're still trying to find the perfect science for triple negative breast cancer. Okay. And unfortunately, we have not found, but it doesn't mean that all triple negative don't bad. See, when we're telling you triple negative now, there will be few patients who are seeing this. I'm triple negative, abhi kya hoga? Don't worry. If in my own practice, the only patient which I can count on my finger who got terribly, did not get any results of the treatment was only one triple negative patient. Oh. Okay, and I must have treated probably approximately maybe 100-150 triple negatives.
So out of 100 and 150, there might be one-off cases which
did very
not
bad.
Respond. Or
which did very bad. Yeah. So you should not get too worried after this. You just go back and report. No, you cannot catch future. Okay. If you cannot catch future, don't think about future.
Also one more thing. Now that we came to discussing this, the mental health. Sometimes sometimes you get the name only kills. The cancer, the treatment, the bimari, everything is different. But
Yeah.
the name that God forbid someone's get got cancer, makes you so anxious.
The whole
It
family,
is
the whole family goes back, takes a
yeah,
step back, and
yeah.
I understand it's a very difficult thing, but I always
So,
feel
so
that.
in this situation, what is your advice to a patient?
So, moment you get diagnosed as cancer,
And
now,
in your experience also, you must have seen
Yeah.
that people who have been a little more calmer or who have followed a certain lifestyle have done a little better than people who have been a little hyper.
so the
And
people who do not have what teetotalers, they do better than the people who have habits. So when you say cigarette smoking is injurious to health,
it is
how
actually.
how I put it,
Mhm.
cigarette smoking is injurious to your health when you get a disease. So when you get a disease,
Yeah,
the
so that's a very good message for our youth, when you're so stylishly thinking, okay, fine, I've been smoking for so many years and nothing has happened to me. Thank God nothing has happened to you. And it's not that maybe smoking will do it to you, but if you have some other comorbidities or something happens to you, the smoking is going to take your treatment,
Back.
your treatment behind,
Yes.
hold you back from getting well soon.
So smokers do not do well when you get cancer, but non-smokers do very well when they get cancers. I can tell you all oral cancers who do not have
Is this
tobacco.
also a proven fact?
Yeah, it is a proven fact.
Okay.
And I don't have to look anywhere else for this proving it. I've seen it in my practice only.
Mm-hmm.
Okay. Non-smokers, non-drinkers, they get cured.
Mm-hmm.
Smokers, drinkers, they sometimes come back with recurrence, and then we know why it is.
Okay.
It is not related to usually a bad surgery.
And that time to leave that habit is very, very late.
Very, very difficult.
First you're fighting with your emotions, you're fighting with your disease, then you're fighting again with those habits that you've inculcated.
Yes.
So we were talking about how one should maintain the mental health,
When
how
you get
not get
diagnosed.
scared of cancer, and what are the lifestyle changes that they have to inculcate.
So look at the journey. Okay. First, find out what the journey about a treatment for cancer is. Get educated about it, and then you'll realize that it's not such a difficult journey. Okay. You getting scared without knowing the journey is of no use. Okay. Learn about it. Talk to your oncologist. He will put you at so much ease as to how to go about your treatment that at the end of the day you will say, okay, fine. See, what is education? Education teaches us what? Not to pass or fail. Education teaches us when there's a difficulty, come out of it. So you are in a difficult situation. Okay. There is a bend in the road, right? Learn to negotiate that bend. Don't get into a crash.
Yeah. So
Okay, and we are
negotiating
there.
is also putting in your own effort.
Own efforts.
Like following good habits.
Yeah, good habits,
sleeping
important.
well.
Sleeping well, having good diet. Okay. See the diet, whatever you
Also,
are.
one more question people may ask is non-veg allowed when you are going through all
So
these
I would
treatments?
say whenever you are taking this treatment now, you should not have non-veg. This is my personal opinion. Also, it is well proven fact that you may end up with more infections. Okay, when you are having a non-vegetarian diet. So predominantly you should avoid it. But I tell my patients, have it once a week. Be happy with it. I also want your pheromones to be released. Okay, so that my cancer treatment gets better. And I said,
And stay in the happy zone, meet your friends.
Yes.
Don't give up your day-to-day life. Treatment is going to continue.
And I'll tell you one important thing. Don't discuss your cancer treatment with too many people.
Yeah. Don't
Okay.
take like too many advice. Sometimes can also fall
it's
you
very
down,
simple.
right?
When your things are going good now in your life, no one is going to come and tell you that even my things are going good. Okay, so they will be telling you some soft story only that this cancer patient, this happened, that happened. No one comes and tells you that अरे वो patient तो 20 साल से बढ़िया है यार. This is what even नहीं है बढ़िया तो भी उसको जाके बोलना है.
Yeah, always the negatives are stronger than the positives. So stay connected with the positives. Don't pay attention to the negatives.
Yes.
And trust yourself. Believe in yourself and your doctor's treatment. And I'm sure you'll do really well and stay longer, right? Doc, before you leave, can you just share a few examples, few cases which will inspire our audiences to stay strong?
I already put in the 16-year-old girl. Okay,
Yeah.
उसको मैं नहीं भूल सकता है. The energy, the spirit,
The vibrance.
the vibrance. It gave me a spring in my legs. Now, apart from this, there is another lady who was treated by me for 4 years. She was stage 4 ovarian cancer, and I used all my experience, whatever I could do for her. She was told by a premier hospital that she's going to live for 6 months. and we stretched her. She lived 4 years. The important part is what did she do in the 4 years. So she completed her 25th anniversary, her 51st birthday. Her son he was doing some fasting in Giants. So the son did that 8 days of fasting and they had a function. Atai, they used to tell that that a function. The daughter got married. The daughter got a kid, and she went to Goa and did paragliding.
Wow, that's getting me goosebumps.
So all these things she did in the 4 years. So many people now tell me, sir, my relative na, she had rectal cancer. She lived only for 3 years. I asked them, what did she achieve in 3 years? That is more important.
Yeah, the bonus that
Yeah,
they
you
got,
will look
if they
at,
wouldn't have treated themselves.
if you would have not done, you would have not got.
Yeah.
And we are talking of 3 years, 5 years now. Maybe 10 years back we started talking. Before that it would not be like that, right? 2003 or not even 2003, 1995, 98, we would not talk of so much survival. Now we can give you.
So should we say that earlier there was just very little research in place, and
So there were research.
today we are little better and we are hoping to get there.
It is
and
the
one
research
fine day
in the
cancer
past
will
now.
be treated.
No, it is the research in that time which is helping us now.
Okay.
Research is not that 2018 it happened and now 2020. No, this is going on from years. We are reaping the benefits in this generation. As simple
And
as that.
next generation will reap it more.
Yeah. So basically, the thing is that you have to do your best in whatever you're doing, the doctor as well as the patient. As simple as that.
Age has something to do with your recovery.
Oh, now this is a very big topic, man. Older the patient, better the prognosis.
Is it?
Younger the patient, worse the prognosis. This is a cancer paradox. What is the paradox? So cancer has two paradoxes. One paradox is younger the patient should do better. Now usko bahut
Of
zinda
course, yeah, naturally.
नहीं पर उल्टा है. Younger the patient does worst. Older the patient does better, which is not good.
Which is generally in cancer
in this,
situation.
when we're talking about cancer awareness, this is not a good thing to learn, but it is something like that. So that is why I say कि अपनी जिंदगी में habit से दूर रहो, so that you reach old. Because when you reach old,
Yeah.
you can become very old because you can
Maybe
get
also
cured.
this paradox is because of the lifestyle changes that the
Yes.
younger people have seen and
Yes.
what we have lived
Yeah,
earlier.
there's a change. The second paradox, when the cancer is too small, it is very difficult to detect, and the patient comes very late because it doesn't throw symptoms. When the cancer is too big, the patient comes running to you. Okay, we are able to detect directly, but we are not able to do anything.
Okay.
That is why Tata has this lovely line: if detected, cancer is curable if detected early. So everyone, please learn about early detection for your own health.
Okay, one more thing. Now that we're talking breast cancer, like other cancers, is there a weight loss in breast cancer too?
Yeah, there is, but that is an advanced stage, not 1-2.
Okay, so that's where.
Yeah,
that
because
we
breast has nothing related to the swallowing part, right?
Okay.
The food part, but in stage 4 they lose appetite. So
and
1,
that's
2,
where you-
3 also they lose, 1 and 2 nothing. 1 and 2 the woman does not know only.
And there's no reason for the cause.
Idiopathic. So you can talk of stress and smoking and alcohol and obese women, female above 40. These are the side. So being a woman is the first factor. Above 40, fat, unmarried. These are all common.
Okay.
But most important, there is no known
Okay.
pathology.
So, but there's no such formula in cancer, or in any ways, it's never there in healthcare. But is there there's no formula as such, but there are some precautions that you can take. No smoking and all
मैं
that you told us.
मैं आपको सब cancers का एक साथ बता देता हूँ.
But for example, हाँ बता दीजिए.
एक साथ बता देता हूँ. बहुत simple.
You repeat that line. मैं आपको सब cancer का एक साथ बता.
We will tell you about all cancers in one go. Okay, so this is a borrowed line from someone who gave a speech somewhere, and I just like to steal that line. So I'm telling you, this is not mine. This is someone else's. So in our older days, what we used to do, पैर को रखते थे गरम तलवे को, कैसे वॉक करते करते. Okay, पेट को रखते थे नरम, how by eating सात्विक फूड. Okay, और सर को रखते थे ठंडा, 7-8 बजे सो जाने का, दुनिया को जो होना है होने दो, मैं तो सो रहा हूँ. अभी इट इज उल्टा, वी डोंट वॉक. तलवे को रखा अपन ने ठंडा, सब जगह अपन गाड़ी वाड़ी सब कुछ. ओके, पेट को तो अपन ने पता नहीं, वी हैव मेड इट लाइक अ गटर, एनीथिंग गोज, इट डजंट मैटर. ओके, सो वी आर नॉट ईटिंग इट प्रॉपर्ली. ओके, एंड लास्ट, our head is always गरम. So उल्टा कर रहे हैं अपन.
Always गरम and always full of.
तो वो जिसको ठंडा रखना चाहिए उसको गरम, जिसको गरम रखना है उसको ठंडा. So the basic fact is what? exercise, eat well, don't take stress, and you should be away from most of the cancers. However, if you do get cancer, if you follow these three things, it will be completely curable. Okay, people who have habits now are per se not bothered about their health. That's why they are having habits. No, people who do not have habits, they are bothered about their health, so they will come early to us.
Okay. Now, last question, which
ये डालना है, मस्त है यार, ये डालना।
बहुत अच्छा है. When we were talking about age, so we spoke about 16 years old, we spoke about 40s or something, 40, 45. What if have you seen any case of somebody getting breast cancer at 70, 75 too?
Oh yeah, many,
75,
many.
80,
Yeah, many. It's very common in that age. But I'll tell you, all of them now, I only operate them about 75. I don't give chemo, I don't give radio.
Oh.
I only operate about 75 people. And
Why
they,
so?
I don't know, yeah, they do very well. Usually I get,
Yeah, firstly, emotionally, they are not very bothered about
Yes.
a part, a organ.
Yeah,
being,
yeah. And somehow or the other now, the fact that she's reached 75 now means they come in early stage only, somehow or the other.
Oh, achha.
Okay, they come like stage 1, stage 2.
Okay.
Very rarely do we get stage 4 in 70, 75.
Because at that age, I think they're also very conscious about हर एक चीज का
Yes,
बीमारी.
yes.
And
Even
they're vigilant about.
Fortunately, in India, the parents stay
They're
with us
less
now.
busier. Yeah.
No, the parents stay with us, so the children take them quickly.
Oh, okay, that's nice. That's also a good way to look at it. Yes.
Yeah.
But yeah, maybe initially at 40s, 45s, women are busy making their career. They're
Yes.
busy with their children. They're busy with their husband, and they tend to ignore themselves. Today, I will say, don't ignore yourself. If you're fine, your family will be fine. It's better to worry how to keep yourself fine and keep them fine than to worry what will happen to them after I go. So please take care of your health. Please get your checkups done on time, and it's curable if you keep a positive attitude. Keep going. Good day. Goodbye.
Okay. I'll see you, ma'am.
वन सेकंड मैम,
हाँ?
वन सेकंड, वो इनका नाम है थैंक यू वाला वापस ले लीजिए एक बार.
हाँ.
क्या है वो वाला?
हाँ, इनका भाई नहीं बोला. ठीक है, चलो.
मुझे नहीं बोलना ना, मैडम को बोलना.
हाँ मैडम बोलेगी.
Thank you. Good day. Goodbye. And thank you, Dr. Amit Gandhi, for spending your valuable time with us. And I'm sure my audience. And thank you, Dr. Amit Gandhi, for spending your valuable time with us and enlightening my tongue twister. Thank you.
नहीं आराम से सेम नोट हाँ.
And thank you, Dr. Amit Gandhi, for your valuable time. I'm sure my audiences have gathered a lot of information today, and they are going to be very, very vigilant and going to take good care of themselves, and they will know if they need us, we are there for them. Thank
It's
you.
my absolute pleasure, ma'am. Thank you.